that was also one big thing that changed after Obamacare was that there were, 23 million people who got government subsidized insurance. And the argument was that this gives them access to health care. What nobody knew about was that the number of total visits to primary care decreased after that by 17%, because although the 23 million got this insurance, it didn't cover the other expenses of getting to the doctor's office, lost work days, the drill.
Everyone, and welcome back to another episode of Wellness at the Speed of Light. Thanks for joining us today. We've got a great show on tap. This one is a three-way conversation, which is my first down that road, and I think it'll be really interesting, and I think you guys will learn so much from two really amazing guests that we have on our program today. The first is Dr. David Slater out of Dallas. He has been practicing medicine now going on 30 years. He's always been an outside-the-box thinker. He's been a radio show host. He's got an amazing voice and a much better microphone than I do, but he's going to give me some tips by the end of the show. And we're excited to have him on, as he is really at the cutting edge of treating patients the way we really should be, looking at them with a much more holistic approach. He's so concerned about the opioid crisis and everything else that's going on. And the reason that I'm really excited to have him on the show is, as you know, I've spoken up quite a bit about some of the issues in American medicine, and one being that we may not be treating patients really the way we should. We really need to get better answers other than just medications and procedures. We really need to be looking at the human body from a more holistic approach. So excited to hear what he has to say on all of these topics. Our second distinguished guest today is Dan Herbert, who is the founder and CEO of the CureWave laser company. He has created himself a really amazing product. It's something that has gone through a lot of scrutiny. It has some significant advantages. He is an absolute expert in everything laser. And the reason that he is on the program with us today is because we have both experience with the CureWave laser. I have experience personally using it on myself, but also having treated numerous people with the CureWave laser, as has Dr. Slater. And we thought it would be just a privilege to have the actual founder of the company that has developed and designed really an outstanding device that most people have never heard of, but is treating so many people's chronic and acute conditions with such a high degree of success. So welcome to both of you today. Excited to get going on this three-way conversation. And I promise I won't monopolize most of the talking. It's all about you guys today, because we really have a lot to talk about. So I'm going to get it started with Dr. Slater. Now, you've been in practice for 29 years, going on 30 years. We have previously chatted about both of our frustrations with where medicine has gone and how people are worked up. I'm going to ask you a really broad question. And that's the following. What is wrong with American medicine today?
Oh, so a relatively simple question to start, right? It's obviously multifactorial kind of stuff. The cost of going to the doctor, paying copays, paying for insurance, paying for medications is just horrendous. And then the other thing we've quit doing is really making health part of our lifestyles and teaching it in grade school and high school, college. I mean, you should know what cholesterol is. You should know why you shouldn't have high blood pressure. You should know some of the concepts of diabetes. But I have patients that come in and, of all walks of life, to be sure, and they're so underinformed, and it's really sad because they know about everything else. They know about their sports teams, and they know about, TikTok and everything else, but they don't really understand how to maintain their bodies. And so it's put a lot of pressure on the healthcare system. And one of the examples is that if you put up a map of the contiguous 48 states in 1990, and you ask the question, show me in red the states who have greater than 5% of their population, they have diabetes. And it would be Louisiana, Mississippi, Alabama, deep South, Georgia. If you put the same map up today, they're all red. Wow. It's not a genetic thing. It's a this is how we live. Our foods contain high fructose corn syrup, which is not allowed in most of the countries of the world. I mean, we're just not creating the healthiest environment here, and it shows.
Yeah, and it also shows with the fact that we spend more per capita on healthcare for all of our citizens. And yet, if you look at diagrams, you name it, you name the chronic disease, it is going in the wrong direction. Diabetes, obesity, Alzheimer's disease, all these other things. And on that note, you made a great point. I mean, education is so paramount here. And I spend so much time talking to my patients, and sometimes I am baffled by how little they really know about well-being, just general health and wellness, and how to prevent some of these chronic diseases. I mean, completely clueless. How do you think we got into a situation where the level of education in the general population is so poor? Is it because we're not teaching it in schools, like you mentioned before, or is it because there's so much outside influence through various industries where this is almost on purpose that people are not educated on how to stay healthy and well?
Yeah, when I was a kid in grade school, they didn't have Coke machines. Okay. It was, you bring your lunch pail and whatever your parents wanted to give you to drink, but you didn't have the option as a, 10-year-old to go buy a Dr. Pepper at lunch. And so that's a direction that shouldn't have happened. Another one is everybody at school went to recess. We did jumping jacks, and now all of that stuff's just disappeared. It's like a completely different world.
It's unbelievable. And you think about, what you brought up is a great point and something I talk about quite a bit. And those are the toxic, just food environments around us. So we're sticking our kids and our population in general. The example I always give is I can't tell you how many patients I see, for my first visits, at 8 a.m., they're drinking that huge, giant, a Slurpee or a huge Frappuccino, double, triple Frappuccino, whatever they're drinking, and they're starting their day off with a 1,600 calorie drink. Nothing good is going to come of this. And that is how far down this rabbit hole, we've gone. And, diabetes, obesity, Alzheimer's, they're all tied back to, like you said, these high fructose ingredients that we have and just processed foods and other things. So, education is something that I am rabidly passionate about getting the word out, which is why I'm doing this project. I just started a radio show, trying to follow in your footsteps. First episode drops here in July. But that being said, how do we get the word out? How do we start educating the population? And the other question is, are physicians and providers educated enough on this stuff in a different way, enough to then make enough of an impact? Or do we need to change the education of our young doctors and other providers that are at the front lines of seeing these patients initially?
Well, I'll give you one. Where's the term doctor come from? It comes from the Latin term docere, meaning to teach. And that's how it used to be. And now it's translated into to prescribe. And there's a lot of this good basic information that is not being conveyed. For example, talking about kids and a soft drink. If you weigh 200 pounds and you have a Coke, that Coke is distributed over 200 pounds. Food's a drug, right? There's no analogy needed. It's a drug. If you weigh 50 pounds and you have a Coke, that's the same as if the 200-pound dad had 4 Cokes. So it's a zone of distribution, and that's the deal. One cookie to a small kid is equivalent to a bag of cookies to the adult. And people just don't, it's just one simple thing.
Yes.
People don't understand that when they hand over a cupcake to a 4th grader, that's the same as you eating the whole cake, and you wouldn't do that. So I think that we've got to make it somewhere along the line. It has to be a national effort to see to it that people pass some health and nutrition classes, because it's quite an environment out there. I mean, we always tell people that food should look like food. So if you're in the produce aisle, you're in pretty good shape. If you're walking down the meat counter, you're pretty well in good shape. But if you're walking down aisle 6 through 35, where everything is canned and boxed, that stuff's not really that good to eat, because in order to can it, box it, or otherwise process it, make it last, you got to cover it with preservatives. Nowadays, over 90% of 55-year-old men and older on high blood pressure medicine, because it's thought to be due to a lifetime exposure to sodium products.
Yeah, I mean, there is so much that we need to educate on, which is again why, I made it a huge, priority of mine personally. And I know you have, with your previous shows and everything that you do in your practice, where we just need to be out here as physicians, the ones, and again, I don't want to pick on anybody, but we really need to start focusing on preventative medicine, lifestyle medicine. We are not doing that. I question my patients ad nauseum when they come in to see me for their spine condition. I'm giving them, the fifth degree on what have you been told about this? What have you been told about your diet? What have you been told about your diabetes? How are we working on this? They're not aware that 87% of people will reverse their type 2 diabetes by just going on an intermittent fasting program. They're not aware of their calorie intake, how bone health is affected by, their weight training. I mean, I can go on. It's such a source of frustration for me. I just wanted to, and then that's what eventually led me to say, you know what, I'm done. I'm going to be out here. I'm just going to do this. And I'm going to get guys like, the two of you on here that understand that there's so many amazing options that are not even being offered to the general population to help them, and we need to do something about it. And it's not okay to stay on the sidelines, because if you're on the sidelines, you're complicit, with the whole thing. So we got to be out here.
One of the things that changed after Obamacare got going is that obviously, if you like Obamacare, you're going to like it. If you don't like it, you probably don't like it, right? I don't think too many people jumped sides on that, but it did affect the cost for people who were having to pay for their health care. And what we saw as almost an overnight change was patients coming in, putting kibosh on us doing other stuff. Just do what my insurance covers. Well, insurance cover that. It's not really supposed to be our responsibility to know what your insurance program is, but that's the way it went. Someone come in, I'm just for a physical. Well, we ought to do a vitamin D test. Is that part of the physical? Probably not. Then don't do it. And it's like, this gets into the, go ahead.
No, that's a great point, because what happens there, you create acute becomes chronic in so many conditions or problems, and chronic is 100 times harder to treat than acute injuries or pain or condition.
And what percentage of the population has low vitamin D, low being less than optimal? It's 99%, probably 98% just being, hopeful, but it's pretty much everybody. The people with light colored skin avoid the sun. The people with darker colored skin have a beautiful protection built in their skin color that diminishes the effect of vitamin D on production of vitamin D. And so they should be looked at. You should take the appropriate amount of vitamin D, and you can't just wing it, because vitamin D is on that short list of vitamins A, D, E, and K, that if you take too much of it, it's not good for you.
Yeah, I mean, I think you just brought up an absolutely brilliant point. And I get into that, now that I've gone down, into the wellness world. Now I say wellness because, I mean, honestly, we say wellness because some of these things are off label that we're using. And so we like to use words like wellness, but what are we doing? I mean, really, anybody, when you go to anything, you go to, a massage therapist, you're treating something, right? You're still doing something. And so it is unfortunate, because there are so many people that can benefit from quote unquote off-label uses or things that are not covered by insurance. I mean, dramatically benefit from it. And the sad thing is, and we're going to get into laser therapy, something that I am beyond passionate about, photobiomodulation, the fact that the vast majority of insurances do not cover, photobiomodulation and laser therapies. I don't even have a good word to use where I can be nice about it. So I don't really want to have my audience think that, I'm just not a nice, wholesome guy. But I can just tell you, it is ridiculous that people are not being able to afford laser treatments or different types of photobiomodulation. We can go into the different types without having to dive into their own pockets. Now, the thing is, people are starting to wake up, and with the increasing copays, as you mentioned before, and deductibles, all these other things, people are starting to really wake up to the fact that their healthcare dollars need to go somewhere that's going to benefit them. I'll give you a great example. If you go to see whoever for an initial visit, a wellness visit, right? You just go to your doctor, whoever they send you to, right? Because these days people go where a lot of people still do that. I go where I'm sent, right? If you go there and all you do is have your blood pressure checked, your heart rate, measured, your breaths, all the usual stuff, the most rudimentary stuff, and you get a clean bill of health, but your complaint is, hey, doc, I feel awful. I feel miserable. I'm not well. You're not getting anything out of that. Or they're just like, well, everything checks out. It's great. What is the value that you're getting from that visit? Whereas if you go to, other types of docs, functional medicine docs, guys like yourself, naturopaths, wellness clinics that do this, integrative health clinics that are really dialed into some of these other modalities, you're going to get a much wider battery of tests. You're going to get the treatments you need. Now, are some of that out of pocket? But again, for example, going back to laser therapy, if you're paying X amount of dollars, even if it's several $100s a month to get laser treatments, but you're getting a dramatic benefit, how much better is it than dipping into your copay and getting nothing, literally nothing?
That was also one big thing that changed after Obamacare was that there were, 23 million people who got government subsidized insurance. And the argument was that this gives them access to health care. What nobody knew about was that the number of total visits to primary care decreased after that by 17%, because although the 23 million got this insurance, it didn't cover the other expenses of getting to the doctor's office, lost work days, the drill. And the other people who were paying out of pocket more for health insurance cut back on their copays by not going. And that's why you saw that instant increase in urgent care centers pop up on every street corner, because that increased 19%. That's where people ended up going. They would wait until they couldn't wait anymore. And then it's off to urgent care.
So, going back to that, before we start diving into, these so-called complementary, treatments and things like that, things obviously we all believe in. So outside of creating kind of wellness models like you have in your clinic, we're doing separately. Like I literally had to go outside of the system with partners to create a separate sort of primary care track where people can get the type of care that we feel like they need. I mean, it's outside of the medical system, but these are physicians, though, recommending it, saying this is better for you. Oh, and by the way, they're really low cost care. This is not like, hey, we're going to implant all this stuff in you and we're going to put probes in you and do all this stuff. No, it's like we're going to treat you with light, water, oxygen, all of these things that have decades of research, thousands of papers, and yet they have to go outside of the traditional medical system. Oh, and let's not get into the whole entire thing that happens, which is they go back into the traditional medical system and they say, hey, my doctor treated you, this other doctor, he's treating me with laser therapy, oxygen therapy, all this other stuff. And a lot of times, why is it that the response is, they're annoyed. They're upset that their patients are doing that for things that have such a low risk. Like photobiomodulation, what does the FDA say? Clinically insignificant risk. So why are other providers upset that their patients are seeking that type of care? What would you say about that?
Well, in all my years of practice, what I found is that it's just a relatively small percentage that's willing to go outside, not just the box, but the way that you're trained. It's, this is what we do. This is what we've been doing. And somebody comes up and says, hey, this is a bigger, better, faster way to do it. And they just, yeah. And so there's this whole world of medicine that insurance covers, Medicaid, Medicare, workers' comp. That's the typical healthcare world, where there's a completely separate world of stuff that insurance doesn't cover. It's cash only, whether it's expensive like stem cell or inexpensive like laser or acupuncture or hypnosis or medical massage, which is often not covered, or hyperbaric. I mean, just run the list. It's a complete world of healthcare that is not that the insurance companies consider experimental. And it's like, really, our bodies respond to light. Imagine using a particular wavelength to stimulate healing. I mean, we all accept the fact that vitamin D is produced from a particular wavelength of ultraviolet light. Well, you can't see ultraviolet, but it works. Another wavelength of ultraviolet causes skin aging. Another one causes cellular damage at the DNA level, so you get skin cancer. Can't even see it. And you get up above the visible light, you get into infrared. We always experience that as heat, irrespective of where it's absorbed. And when you change the wavelength, you change the tool. So, as Dan well knows, hair removal laser, 1064 nanometer wavelength, not 1063, not 1065. It's 1064. and that's wickedly absorbed by pigment. And at the base of your hair follicle, you've got a fair amount of pigment, and a few picoseconds of high energy will just and superheat it, and that's why it hurts and it kills the hair follicle. But it's just light. It's a particular beam. If you go outside in the sun right now, you'll walk into some of it, a lot less energy.
And Dr. Santa Crosby, I think you told me a story a couple weeks ago about regarding this question. I've heard this dozens of times from our customers. You were telling me about a lady who came in, had back issues, and you said, let's try the laser first. Well, that got her to a point where she didn't need the back surgery. And I think that's where doctors are finding it's a loss, where if she has to go now, she feels better, and you prolong that. When it is time to get that surgery, there's no second guessing. You're the person who's up there and up front. You're building equity with that patient. I don't think a lot of doctors look at it like that. They look at it as lost revenues versus building equity with the patient.
I hate to say that, but I've talked to enough doctors over the years about using this therapy, and they've already got other modalities like epidural steroid injections, or for a frozen shoulder, manipulation under anesthesia. I mean, the idea that someone could come in and ying 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 for 20 minutes 4 or 5 times and that would take care of it is just right over the head. And as I was telling Dan about 9-10 months ago, there was an article that came out in one of the pain management journals, essentially congratulating Texas physicians for decreasing the amount of opioids prescribed by 13, 14, 15%. But later in the article, it also kind of chastised them for not having something else. It's like, and you have a ethical obligation, and legal obligation to treat pain. And if you just cut back on somebody's, oxycodone, it's like, so what else you gonna do?
Great job. Now what?
Yeah, I mean, I agree with all that. I would say that, one of the guys that, I've become friends with and is absolutely a true pioneer and leader in this space is Dr. Scott Sigman, otherwise known as the Fro. Dr. Sigman, I had him on the show, and now, we've been talking quite a bit. I'm actually going on his show pretty soon here. And it's very interesting because you brought up the thing about, well, you go out in the sun, you can't see those particular rays, but yet is doing something for stimulating, production or changing in vitamin D. Whereas he uses the analogy when he opens up to people that are skeptical, he uses the analogy, well, do you believe that light makes trees grow? Do you believe in photosynthesis? And he's like, yeah, everyone shakes their head. Yeah, doc, I believe in photosynthesis. Yeah. And he says, well, photobiomodulation is just taking light to modulate tissue. It's the same exact thing. It's just a little bit of a different process, but it's the same concept, of how it works. And one of the discussions we had, obviously, on our podcast was the fact there is so much skepticism on something that it is so powerful. And it is frustrating to me, as an orthopedic guy, a spine guy, who has seen it on my own patients have dramatic effects. Not in everybody. There are certainly many, many people that need surgery, injections, or whatnot, but in so many people. And so that's why I'm glad that actually Dan brought up that conversation. I had a patient, she had a significant degenerative scoliosis. She had had pain for about 10 years, lots of pain, all right? And she's been treated by every pain management specialist, was getting really frustrated, and finally said, you know what, the heck with it. I'm going to go in and just finally have my surgery because people have said, you need to get your back fixed. Something's going on. So I saw this poor lady, and obviously she was on narcotics and some other things. And I said, listen, I think you do need surgery, but in that instance, I needed to get other scans. So I had to get some CAT scans. I needed to get some full body scoliosis series, some other serious workup before we would contemplate doing surgery. But in the meantime, I said, you know what? She was reporting 9 out of 10 pain. So I said, I'm going to put you on a laser therapy program, not in any way, shape, or form thinking what I was going to see next. So anyway, set her up for laser therapy. She ended up going to one of the centers to have laser treatment, and she came in. She seemed kind of bouncy when I walked in the room for somebody that was going to have a discussion on having a major scoliosis reconstruction. Get in the room, lady gives me a hug and basically says, I said, are you okay? And she's like, oh yeah, I'm amazing. She's like, I did the laser therapy and I have no pain. Almost a decade of suffering, I have no pain. And I was completely taken aback. I took some pictures with her. We did the whole thing. We love seeing our patients obviously have great results, whether it's surgical or non-surgical. But the kicker was this, and this is what the problem is as far as some of these treatments that have, oh, and by the way, there's 6,000 papers on photobiomodulation in the literature, not 6. As some people would try to kind of spread rumors. It's 6,000 plus and growing. So she said she was so baffled, so happy about it that anybody that would listen, all she could talk about was laser therapy. She had no interest in talking about anything to anybody, family, friends, anybody. But interestingly enough, she said everybody was skeptical. They didn't believe her. They're like, no, that doesn't do anything, right? The usual that we get with this stuff. But the kicker, the thing that made me really laugh, and she's like, oh, you're going to get a laugh out of this, is she went to her dentist and she's lying on the chair, just kind of waiting. And she's so excited about laser therapy. So she starts telling the guy the science about laser, all this stuff. She's like, oh my God, you got to send your people with jaw pain and all this stuff for laser therapy. And the guy said, whoa, 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 stop. Stop. What are you, some kind of rep for them? Are you trying to sell me a laser? They can't, like, it's some people can't even, they don't even want to talk about it. Like there's no threat to a dentist laser therapy, but yet even they, like, because it wasn't taught in dental school. And by the way, dentists, dental school and medical school, we often do that same track the first 2 years. All your basic science is the same, and then you split up. But yeah, I mean, there's such I think that we are so brainwashed, both as physicians, providers, what have you, and as the general public, we're so brainwashed that these easy solutions, and I don't want to say easy, nothing's easy because there's a lot of science behind them. It wasn't easy to create these lasers, but we cannot wrap our minds around, oh my God, oxygen therapy is going to, improve my depression or post-COVID syndrome.
So you said something extremely important, that you told her that the right thing to do at that moment was do some laser therapy. It's an interesting thing, the psychology of pain. It's even part of pain management. Part of the job is to get their pain to a tolerable level and then let them live with it. So they get it from a 9 out of 10 to a 4 out of 10. Then the patient gets used to it. This is my pain. It's 4 out of 10. And they believe it's going to be 4 out of 10, and it is 4 out of 10. That meets their expectations.
Yes.
Okay. So here's a completely, here's some psychobabble. You go into the patient, and for the first time in 5 years, you tell them, by the way, we can reduce that 4 out of 10 pain to a 0. If they believe you, then you've raised their expectations, but their pain is still a 4 out of 10, which means the difference between expectations and performance, that's a definition of disappointment. So in the act of offering a solution, if they believe you, they immediately experience, well, then how come I've been hurting for all these years, and all this disappointment kind of psychology. So what I quit doing is telling my patients how well it worked. I just tell them, I think that's important. What we need to do is laser therapy. I go, what's that? Well, it's a special treatment that reduces pain, and we'll see how much. And they're like, okay. Yep. And that's it. But yep. When you tell somebody that we can make things better, it's just part of the psychology of listening to someone. And even if you tell your family members this can help your foot pain, they respond with skepticism because their brain's trying to protect them against disappointment. How long does it last? Well, how do I know if it works? If I don't know if I want to spend that kind of time and money. I mean, they have all these kind of rejective responses that, you have to get around. And quite frankly, one of the things that, part of the theme of this call, a lot of doctors don't want to sell somebody on spending money. I mean, they have an abhorrence to telling somebody, hey, this costs $500 and you should do it. And
for a series, though, that's very reasonable.
Yeah, I mean, one of my clinics, we charge $500 for 6 sessions. That's $83 each. Yes. Oh, okay. It's not killer. In my clinic up in Little Elm, Texas, where I am most of the time now, in the last 2 months, we've done 120 laser sessions, and many on the same people, of course, but about 100 probably 80 different patients. But 2 guys in their upper 60s on a cane, greater than 3 years now, not on a cane. One lady with 50 years of right hand pain from her 20, she's 74 now, dropping knives, dropping forks, and loves to cook, but can't. 2 sessions, 3 sessions, no hand pain. I mean, the list of, I've been doing this for 7 years with the laser stuff. The list of stories is certainly enough to make you cry. I mean, I told you that one about
yes.
that girl with the foot pain for 10 years, and we lasered her half a dozen times and the pain went away. And the thing is, whenever you prescribe a therapy or a medication, you're always balancing the risks benefits, the cost, the time involved, any component of it that in order to balance that out. Well, the laser scores on all of those categories. It's not particularly expensive. It's not particularly time consuming. It's not painful. The risks on it are, guess the patient could trip getting up on the table. And the benefits would be, oh, I don't know, you have the option, or you have the possibility, I should say, of a patient becoming pain-free. I had another guy, he's on a cane. He's been on a cane for 3.5 years, and he's on session 6 right now. And he said the other day, he goes, Dr. Slater, for the first time in 3 years, I now have episodes where I'm pain-free. I said, so you've been in constant pain for over 3 years? Yes. I said, now how long do these episodes last? He goes, 30 minutes. He goes, but when they come on, I don't want to move because you can't do any better than pain-free. He goes, so it's kind of stifling. He goes, if I'm sitting in a chair, I'm not going to get up. But
No,
we expect him to get off his
funny.
cane.
We run into the field when I go out and do some training or what have you, or introducing this. A lot of the doctors, one of their defenses on this is, I don't want to be selling package. And I'm like, well, do you ask somebody if they want to buy a shot for a flu or a numbing cream? No, I just administer it because that's what it does. I'm like, that is exactly how you should do it. You're the expert. People are coming here to say, get me out of pain or get me in a better spot. You're not selling, you're consulting me as a physician, as an expert. And getting that across to people is one of our biggest hurdles, because so many practices can use this. So many people work on soft tissue. You don't want the doctor to become a salesman for you for selling the procedure, but you're training in what can work. If the endpoint is that everybody's better, it doesn't really matter what you charge them. If you take care of the patient, the funds take care of themselves.
Going back a lot of years, when I was in college, had a really, really bad accident. I spent 7 months in the hospital. I did 3.5 years of physical therapy, and I was handicapped for 7 years. And I spent the first 9 or 10 months after the accident in certainly 8 to 9 or 10 out of 10 pain. I had long ago forgotten what it was like to not be in pain. And so when the pain finally went away, it was, the next year after the accident, and that it was just an amazing feeling because I forgot, about living in a world without pain. And when I became a doctor, I've retained that sense of responsibility to my life as a patient, that if there's something that we can do, and again, low risk, then don't you just have to do it? And if you don't believe in it, too bad. Maybe just give it a shot. Just base your decision on the fact that a lot of highly credentialed people know what they're talking about and approve of it, but that's, I don't know, disappointing to say the least.
So what I found with the laser therapy, and again, I'm always very careful, especially when I'm trying to talk to other physicians about maybe trying it or using it or referring people over to try the thing. So sometimes I speak, I don't want to sound like an evangelist. However, the results of laser therapy, and this is something I talked to Dr. Scott Sigmund, to Dr. Paolo Casano, who's out at Harvard, all the guys that are using kind of these photobiomodulation therapies, some of the results, you talk about wanting to cry, are so profound that it is, when you see that, there is no going back for me. It doesn't matter whether or not I have my own centers or I'm sending them somewhere else or they're coming, because I see a lot of patients from way too far. They can't go. So we always spend time trying to find them a laser center that they can go to in their neighborhoods. It is the right thing to do. And so when I'm treating spine conditions now, if they're coming in for kind of bread and butter low back pain that is clearly not surgical, at least not yet, or they're having, one of the things I see a lot of is kind of these whiplash type injuries where, they have degenerative changes in their neck, but they have whiplash. And what was always our go-to? Our go-to is always epidural steroid injections followed by radiofrequency neurolysis, where you're killing the nerve endings and can denervate muscle, right? And so those are not cheap. The patients have to go through a lot. They're getting injected. Supposedly the insurance is covering, but there's a lot of copay in those things. They're very expensive. They're not necessarily the best thing for the system. We have a $4.4 trillion system and growing. So we've got to, at somewhere, we've got to curb spending. And now if I have this technology that is I've seen results so dramatic that I cannot ethically. So when I have been challenged by other, why are you sending this patient for the laser? Why are you doing this? I sent them to you. I've been challenged by physicians who've said, literally, they've said, I sent you a patient to do surgery on, right? And you sent them for laser therapy. And on my response is, I'm a spine surgeon, right? My bread and butter is doing spine surgery. Do you think I'm sending them to the for laser therapy for my health? I'm sending them because I feel ethically and morally obligated to do a low cost, low risk treatment to help them. And I just want to give one anecdote, and then we'll dive into what class 4 laser therapy is, and really get into how it works and whatever. But I have to give an anecdote. A very good friend of mine. Okay, he's a soccer coach here in town. He runs one of the boys soccer programs here. I've gotten to know him. He's a great guy. So he had surgery on his hip about 6 years ago. He had a total hip replacement. Something was going on with his hip, and he developed pain. He was started to limp around and do stuff. We had already treated his shoulder with laser therapy with 100% relief for a rotator cuff issue, right? So he already knew about it, but he never in a million years thought there was anything that could be done for his hip, because he went to the doctor who, again, they use the tools that they have, and they said, well, you might have some looseness. So they started talking about a revision hip surgery. So it was something in the pipeline. So they did an injection, they did some other things, didn't work. He kept getting worse. Finally, he just signed up for surgery. He calls me on a Saturday morning, I'll never forget. And he says, hey, you got to call one of your buddies. Which emergency room should I go to? I need my hip replacement right away. I'm using 2 canes right now. I cannot walk but a couple of feet, and I just want to cry in pain. This is a tough guy. This guy, if he's in pain, something is wrong. And so I said, number one, I have pull, but even my closest friends who do hip replacements, they'll laugh at me if I say, you got to do this guy's hip next week, when they've got a waiting list of 5 months, right? And he's already on a list, and he was like 3 months out or something. I said, maybe we can move you up to 3 weeks from now, but not like this week. It's not an emergency like that. So I said, why don't you go to the clinic and try laser therapy? He had already gotten an amazing result for his shoulder. And he's like, are you sure? I almost need to be hospitalized from pain. I was like, I am very, very sure. So I sent him for therapy, called the person that was going to do his treatment, said, hey, listen, we're going to do laser. He needs the deep laser. He did have the CureWave laser done. And I didn't really follow up with him. After his first treatment, I got some feedback. He was feeling somewhat better. I saw him, I kid you not, I saw him 2.5 weeks later, and I completely forgot, because he's just a friend. I didn't even I forgot. I wasn't even thinking about his hip. I got so much going on. I'm not like, my whole life is not thinking about the guy's hip, right? It's not like he's not dying. He just has, he has hip pain. He comes literally jogging up to me, and he's like, you notice anything different? I said, no, I don't. What do you mean? Because I forgot, because he looked fine. He's like, I don't have crutches and I'm fine. Oh, and I canceled my surgery. Unbelievable. When you see stories like that,
this is not like, oh, last year there was this one case. It's like yesterday before lunch, these were our successes. And after lunch, here's the other successes. I mean, this is a daily thing. And if you threw holy water on someone's hip a few times and had those results, you know what you'd call it. Oh, okay, this is just a beam of light. It's a particular beam of light. It's a well-chosen particular beam of light, but that's all that it is. A little ying, 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 ying. Thank you for playing. Out of quarters. Call it a night. You're done.
Absolutely. Well said. So on that note, perfect time to transition into a little bit of the nuts and bolts on specifically on laser therapy. So, we've got Dan Herbert here he's rearing to go. We both use, the CureWave. We use a couple different types of lasers, but for musculoskeletal, we love the CureWave. And again, one of my closest friends, he got the miraculous result, from it. So Dan, I want to just start with a little bit of background before we get into how laser therapy works. And people have heard that if they kind of follow me. But how did you get into the world? How did you get to be somebody that designs an actual laser of your own? Who does that? It's a pretty random thing for me. How'd you get into that world?
Well, thank you. That's I designed just the wavelength. The engineering stuff is for the electricians and things. But I got in. I worked for IBM out of school. Then went into medical. Want to get in medical like my father. And we had an agreement. We were selling minimally non-invasive equipment. We had an agreement with Heraeus, long since gone. They've been bought and sold a few times. And that was the prostate laser was the only thing there. The only laser they had technology. There's a big old YAG about the size of a Buick, and it was you had to get into the OR. And I remember sitting there clear as day, where my back's against the room, and the system room was always cold in the small room, and it was 60 seconds on, 60 seconds off. and the whole time it's on that lobe and the prostate's beep. It's just annoying beeping sound. It's like, if I never see another laser again, that'll be too soon. And then I got into cancer lasers and aesthetic lasers. I've introduced 3 different technologies to the country, different companies. With this market, there's always been something missing for the wavelength. A lot of the previous technologies are heritable wavelengths. And as Dr. Slater said earlier, it's going in, it's blowing up its target and getting out. I looked at this as, if the goal is trying to get light particles down in the tissue, let's follow the absorption coefficients, find out where you have the least absorption, and then try to find somebody who can make custom diodes, which I did. So, Dr. Hamlin, who was at Harvard, he's kind of like the father of photobiomodulation. One of his last podcasts, which he still does, I know he's retired now, but he brought up the point that, you want to get the wavelength going to determine how efficient you go through the skin. The power is going to see how deep you go through the skin, and the duration is based on how much absorption or scatter you have in the skin is how long you can do that in there. Deliver that energy to the skin. With those 3 things, we're at low peak absorption. We can do a true continuous wave. So we do 60-second intervals. I know you both know that, but for the people listening, we have, at low peak absorption, we have basically less than 3% absorption for hemoglobin, oxyhemoglobin, and melanin. So all the energy goes down into the tissue. And then with our power, the 44 watts continuous wave, we're reaching great depths and getting people. You're only as strong as your weakest link. So if you do a shoulder and you have a rotator cuff and a bursa sac, and you can't reach the bottom of the bursa sac, you still have a problem. So that's what it's doing. And since we're working on a cellular level, not on a chromophore level, not on a target. We're not going after it to hit or destroy something. We're there to provide the energy to the cells. Now, damaged cells will, that photosynthesis you talked about, okay? And to make that maybe a little clearer for people, I use the same example, but instead of trees are hard to see grow. I use the example, when you come out on a March or April or Minnesota June morning, and the roses are down, they're down from a chilly morning, and they look like they're dead and withered. And as the sun comes up, those roses come up, they open up. Same thing. You can see that almost real time happen as the sun comes up. And that's what's happening with cells when they get light. We know light heals. We know it from so many factors. The Nordic quarter, when it's 63 days of darkness, we know wellness goes down. In the summer, it goes up. We know, from the dawn phenomenon, we know all these things. So getting a laser that we can get a wavelength at the low peak absorption and deliver, we can go, I've had up to 90-second delivery and no adverse effects. And those are more for the athletes and things that are just bigger. They're working out more acute injuries. And it's incredible what's happening. We're seeing, I know you mentioned criers. We get a crier a week from the demos that my distributors are doing and our salespeople. When you get somebody on the table and they start crying because the first time it doesn't feel like a hot spike in my shoulder, or my migraine pains are gone. That's a really great rewarding. It's great for the doctor to see that. Yes, there is an option here, an option therapy that we can use that is not out of the PDR or through a needle or a prescription that you have to take, and hopefully it doesn't contradict your other prescriptions. So that's basically my history, about 33 years in lasers. And I've tried a lot of lasers. I've done everything but eyes. And this is by far the most fun, and it is the most effective. You're helping people's lives. It's crazy when you do that.
As you know, I didn't know anything about laser therapy until a couple of years ago when we started experimenting on athletes. I don't want to say experimenting in a way like, it's just, some crazy regime experimenting on people. But I mean, we just tried it out. We were just doing it for free, just treating people. And we saw like miraculous results utilizing laser therapy. And that was the beginning of one. Right is, oh, that's interesting. 3 is, well, maybe it's all a coincidence. And then, athlete after athlete having tremendous benefit. It was incredible to see. And that kind of led us down the path of opening our own clinics, and then becoming, myself becoming a huge proponent of this laser technology, because it just has to be part of the mentality of how we treat pain. I literally was just in DC lobbying for laser therapy this last Wednesday, And I went there and I only had a few minutes. And so I had 2 slides. You know what my 2 slides were? My number one slide were I gave all these statistics on the opioid crisis and said, you know what, for you guys that are in legislation, it's a disaster. 80,000 deaths from opioid use in 2021. Are you kidding me? We talk a lot, but we're not doing anything about it. And just cutting people off from their opioids and not giving them treatments to make them feel better, that's not acceptable, as Dr. Slater brought up. And, when they looked at that study, yeah, you can decrease people, but then they're detoxing, they're doing all this other stuff. You got to help their pain, or they're just going to go back to illicit use or whatever they're doing, right? They'll find it if they're in such severe pain that they can't live, right? My second slide was then hitting them with photobiomodulation. What is it? What is laser therapy? And where does it work? And the fact that both the FDA and CDC have made statements saying on the effectiveness of laser therapy, and yet no one knows about it. It literally was, for the congressmen that were there, they had no idea what I was saying. Nothing, not a clue. And so their aides afterwards were coming up to me saying, hey, we got to talk. You got to send us some articles. This is really interesting. We've never heard of this, before. So there's so much work for us to do, to get these technologies out there. As far as, the mechanism that you brought up, and I want to ask you about skin types in a second, but as far as mechanism, I just want to remind our audience that when we are using these near infrared spectrums, we are basically, what the light is doing is it's penetrating the wall of the mitochondria, and it is stimulating a reaction it's complicated, but there are these different, proteins and other channels that open and close, and lots of things that happen, but it stimulates production of ATP, or the gasoline of the cell, and it fixes the cell. And then it also sends signals to the cellular brain, which is the nucleus, to promote different proteins, which stop cells from dying and make cells healthier. So you really legitimately, with photobiomodulation, you are jump-starting whatever you're targeting, and then it does its own thing. So you're using natural resources on a much higher level than is possible. Like, you can go out in the sun and you're going to get some of these wavelengths, but they're not powerful enough. They don't penetrate deep enough, like you mentioned, to create the desired effects. One other thing I want to bring up on photobiomodulation that drives me nuts, it's 2024. It's 2024, and we're still having a debate whether light therapy works. There was a Nobel Prize won in 1903 for the treatment of tuberculosis utilizing light. It's 2024. How many hundreds of years need to pass before people say, oh yeah, yep, phototherapy, something we need to really be using on so many different, conditions. Okay, I'm done with my rant. So one of the things that has fascinated with me, and when we had our first conversation, about a year and a half ago or whatever it was, when I was interested, because, obviously we've looked at many different laser technologies, but one of the things that really piqued my interest was your very deep and profound knowledge on skin types and your obsession with getting past the skin. Obviously, if you're absorbing all the heat in the skin, and the skin is burning up and nothing is getting deep, that's not going to help anything, right? It's a block. And this laser, so can you talk about the different skin types and why and tell us the wavelength and why that specific wavelength is so good at helping people with especially dark skin to get it deeper into the tissues that we're targeting.
First photobiomodulation system was also the first hair removal. It was a hair removal first, called a ruby laser. It was a 630 nanometer, which is the peak absorption for melanin. I'll tell you what, it took every hair off, anything you treated anywhere, but it also take all the melanin, so you'd have big blocks down the arm every time you made a pulse, which the more dark you are, the higher skin type you have. It's called the Fitzpatrick scale, is what everybody goes by, 1 through 6, and 1 being albino, 6 being African American. With every other laser, you have to skin type. And with 90% of burns come from improper skin typing, because people change their hair color, wear contacts, they don't know their heritage, and so they can't fill out the forms, the questionnaire correctly. When we're down to low peak absorption, we don't even see that. And that's why we can not only treat at the same levels for everybody, the same wavelength, we treat at the same power levels and the same duration, because we don't see color, and we don't see hemoglobin, oxyhemoglobin. So yeah, the vasodilation just comes from heating up the a therapeutic zone. But having that advantage, we can treat anybody, anytime, anywhere, all the same. And tan skin too. And tan skin has more excited melanocytes, so it's harder to treat more superficially. And so when you get to an area that you have higher absorption in melanin, that is basically like trying to spray water under a cabinet to clean it through a paper towel. Okay. All it does is hits the paper towel and expands out. It's called absorption on a paper towel. It's called scatter on the skin. And if all the energy is on top, okay, then you get adverse effects, burning, blistering, hypopigmentation. And then so that's why every other laser has to pulse. We don't pulse. We use 60 seconds true CW or continuous wave. And so that is one of our greatest advantages to be able to treat, according to an anesthesiology news study from Loma Linda, we're deeper, faster, more effective, and safer. Can you ask for anything more than that? It's like the triple crown, quadruple crown of the lasers right there. I believe you, just sorry with it, but I sorry to interrupt you there, but I believe when I first met you, you brought me in there, you had about 14 athletes that you were treating, that they came in, you were treating with other lasers, and they were getting better results with one treatment of ours than 2 months of with the other ones. And that's the difference between reaching down to the DE junction and reaching down to where the problems lie. So
certainly, I think that a wavelength that can penetrate without scattering as much in the superficial tissues. I don't want to bog our audience down with, because we can get into the like weeds with laser stuff. But I think that for soft tissue penetration, I think it's great. And I feel like, I think that the cellular response is absolutely outstanding. I think that for soft tissue kind of treatments or peripheral nerve and things like that, it's pretty clear certain wavelengths work better than others. We see that, and we work with a lot of different types. I think that where a lot of the work needs to be done, and we would like to be on the forefront of that, and we're hoping to really, partner with the Paolo Casanos and the, Scott Sigmans of the world and all these guys, is, for example, when we're doing like transcranial laser therapy or other types of tissues with the cranium, there's so much work that needs to be done in looking at which wavelengths are going to create what changes, right? And so we do know that, in the 800s, there's more studies on that when you look at things like Parkinson's disease and you look at other brain functions, probably because those are the ones that are being studied. We just don't know, with some of these other wavelengths. Now, any type of near infrared, I think, is going to have, some positive effects. We just don't know. And as scientists, we have to get more money through the pipeline. We need the NIH to be listening to talks like this and just saying, you know what, we're going to open up the wallet, because I know, in talking to, my friends that are at high level institutions, they're just like, yeah, the NIH, they like to deny these things for no reason, because they also don't know what this stuff is. But yet on the ground, there's thousands of papers coming out, and we know that it absolutely works. And so I just wanted to say, I just don't want to confuse I want our audience to understand that for some things, there is just straight up FDA approval, right? For musculoskeletal, for pain, it is FDA approved. For some of these other things, our anecdotally amazing, but the studies which need funding have not been done yet to go to the level of evidence that then the FDA is comfortable. However, one thing that I will say about approval is it's interesting that some of these major drug companies, they don't rise to the level sometimes of proving it beyond a reasonable doubt, and they get approval. They get emergency authorization for stuff. And meanwhile, you've got a study out of Harvard for concussion treatment, randomized control, indisputable, showing a dramatic improvement in post-concussion, world. Nothing. It's not FDA approved. And so then you have to explain that. Dr. Slater, how do you get around explaining to people off-label use for things like RSD or whatever else you're using it for? I'm curious to hear, what is your spiel? For me, it's easy. I just say, listen, this is what I think is best. The risks are negligible, and kind of, what have you got to lose? Oh, and by the way, here's 10 papers on it, by the way. I get it's not FDA approved, but here's 10 papers, and look where they're coming from.
Well, I do tell them it's not FDA cleared for, that kind of stuff. But having said that, essentially pain is a local chemical condition. You have prostaglandins and histamines and cytokines that are released when tissue is damaged, and they cause an increase in blood flow and a bit of leakiness to the blood vessels, which is why you get swelling. And then because of the increased blood flow, you get warmth and redness, and then they activate the pain receptors, so you get pain. This laser seeks to reduce that or to eliminate that inflammatory process, irrespective of where the inflammation comes from. So it should make a difference. And of course, as we all know, it always does. It always does. But guys, I'm coming to a hard stop on my schedule. So let me just throw out that I can be reached at Specialty Care Clinics at Little Elm, Texas, just north of Dallas, at 469-200-5974.
And boy, with that radio voice there, how are people? I hope the people from Minnesota are all not, going down to Texas. We've got centers up here. I think summing things up here, I think that we are all so excited about what is coming down the pipeline with light and laser therapy. I would not have spent the week in DC this week, lobbying and trying to get any congressman that I could, tug on their shirts and say, hey, listen, we got to do something about this. This really needs to be ubiquitous. It needs to be out there, and we need to do the right thing for our population. You guys keep talking about how we're running out of money and we can't fund this stuff, and yet you're not, we're not, allowing the use of this without people having to spend their own money. As you know, our population that doesn't have the money to spend on it, again, it's prejudicial. And you talk about you want equity in medicine. This is not a way to do it, to withhold low cost, safe treatments for our patients. On that note, I think that this has been a great discussion about laser therapy. We've done a lot of anecdotes. We are excited about it. I encourage people to go out and really look at the literature itself. You've got a condition. I urge you, put your condition in and put light therapy. Put photobiomodulation in your condition, whether it's a prostate condition, whether it's a lung condition, whether it's pain, headache. We didn't even get into headache. How amazing is this for headache, right? Shutting off headache. Should this be the first line of therapy for headache when you go to urgent care? I think it should be, right? Instead of pumping you full of drugs that are going to, wear off pretty soon. So I think on that note, I hope our audience has a little bit of a better understanding on this. Thanks, guys, for coming on the program today. And we could not be more excited. And I hope to have both of you back to finish this conversation. And maybe we get in the weeds next time and try not to bore too much of the audience. In closing, Dan, where can they find you? Where can they learn more about the CureWave laser and anything else you've got coming up that you'd like people to know about?
We a couple things. CureWave.com. You can learn more about it. Send in any kind of request. We have distributors all across the country. They'll come in and do a few-day demo, because cellular health is a multiple day. We don't just go in and say, hey, there, granted, now stand on your chest and this is buying it now. We want you to be proof that it works so well. And as you know, I think we've discussed this, MD Anderson presenting at a big conference about their 3-year study with neuropathy, getting great results for the pain from post-chemo neuropathic pain. We're now getting protocols together for wound care. I think both of you have seen the traditional therapies I've offered. So.
All right. Well, thanks for that.
And in closing, I'd like to say that with all this technical discussion, the famous science fiction writer Arthur C. Clarke, who wrote 2001: A Space Odyssey, had a famous saying, and it goes like this: generally speaking, any sufficiently advanced technology is indistinguishable from magic. This is magic.
I will say that is a powerful closing, statement. I will. I'm not going to quite go on a limb and call it magic, but I'll say in some patients, it's miraculous. It is absolutely miraculous. And I will second what you said, Dan, on our patients that have peripheral neuropathy and people with RSD, one of the most difficult things to treat. We have incredible success stories on those patients. So I'm very curious to see what comes out of MD Anderson. And I look forward to having those doctors on the program to discuss their findings on peripheral neuropathy and benefits of the laser. So I want to thank all our audience for joining us with Dr. Slater, with Dan Herbert on another episode of Wellness at the Speed of Light. And we will see you guys next time on another road trip down the wellness rabbit hole. See you guys next time.
Very good.
Bye-bye.
Thank you.
Thank you.